Hello, Dr. Christy Funk here, breast cancer surgeon and women's health warrior at pinklotus.com. If you haven't done so already, please subscribe below and join the Pink Lotus Power Up community, where you can meet people and access all the latest resources about your breast health. Go to pinklotus.com/powerup. So today I want to teach you how to do a self-breast exam. This is really important to me because despite the fact that many organizations say, yeah, you know what, skip the exam, they say that because it's true that it causes a lot of unnecessary anxiety. Women think they feel a lump that might be cancer, so they go racing to their doctor. They end up with unnecessary extra imaging, potentially biopsies, causing a waste of money, anxiety, missed work, childcare issues. I mean, it has its ramifications. But in my opinion, this happens because people are not familiar with their breasts. And they should be, because you know what? You're with them 24/7, all day, every day, and I might see them twice a year. So I want you to be familiar enough with your breasts that you are sure that when you find a change, it's really something there. It may be benign, but at least you are sure it wasn't there last month. So the ideal time, in my opinion, is to start self-breast exams way back when you're a teenager, when you start menstruating. Now, it's a reportable phenomenon for a teen to have breast cancer. I'm not advocating that we freak little girls out, telling them they're looking for breast cancer. No, they're just simply learning the lay of the land, getting so familiar with their breasts that it doesn't wig them out at all in their 30s, 40s, 50s to be doing monthly self-exams. And furthermore, they're so familiar with how their breasts feel that if they should stumble across a new lump, which hopefully is a benign cyst or something, they're like, I know that was not there before. And they'll get it checked out. Here's what I want you to know about self-breast exam. You want to do it 1 week after your period starts. That's when your breasts are less tender, less lumpy, and you'll get a better exam. You also want to do it at the same time every month because your breast does change in its texture and lumpiness and tenderness throughout the cycle of your month. So you want to kind of compare lemons to lemons, so to speak. If you no longer menstruate for whatever reason, pick the first of the month. Just check it off on your calendar and you're done. So let's get to it. Here's how you do a perfect self-breast exam. You'll start by disrobing from the waist up and stare in the mirror at your breasts. What you're looking for is a change in the shape or size of one breast versus the other. You're looking for new skin thickening, dimpling, retraction, or redness. And importantly, what are those nipples doing? They should be doing what they've always done. In other words, if they point out or down, if they're flat or inverting in, they should be the same way month to month. Most women will have nipples that do project out a bit, and a concerning change would be for that projecting nipple to suddenly flatten or disappear and go inward, especially if it's in or flat and you can't stimulate it to erect again or protrude out. So those are reasons to see your doctor to get that investigated. Next, you're going to put your hands on your hips and you're going to push your hands in to flex your pec muscle. After that move, you're going to put your hands straight overhead. And what you're doing is manipulating the position of the breast, and you may see, if there's something worrisome in there, a new little retraction of the skin when you flex the pec or move your arms overhead. Another common thing I see when I'm evaluating a woman with cancer is when those arms go up, the breast kind of gets a shelf to the bottom of it. Instead of staying curved, it'll kind of just boop, flatten out. So look for a change in the contour of your skin, one breast different from the other when you're making those moves. Okay, so now it's time to get to the hands-on exam. You can choose to do this either standing up in the shower or reclining on a couch or your bed. Some women find that it helps to have some sort of lubricant, so a lotion or gel on their fingers or shower soap to help your fingers glide across the skin. Not necessary, but again, pick a way to do these exams and then stick to it so you create that unconscious familiarity. This is something that will surprise some of you out there. You are supposed to use the opposite hand to the breast you are examining. So whether you're standing in the shower or lying down, you're going to raise the hand of the breast you're examining straight up and back, and then with the fat pad of the 3 middle fingers of the opposite hand, we're going to do the exam. Now, you can pick a pattern, just stick to it. I don't care which you prefer. That is either concentric circles, like a target sign getting bigger from the nipple towards the outer side of your breast, or you can go back and forth like words on a page, up and down, vertically like words on a page, or radially from out to in like spokes on a wheel. Where are you examining, by the way? The anatomy of the breast is probably a little bit larger than you think. It's not just the breast that's nestling into the bra cup. It goes all the way up to your clavicle or your collarbone, over to your sternum, down to the under part, the fold of your breast where you probably thought it ended. That is where it ends, so the inframammary fold. And then if you draw a line straight from the middle of your armpit down your side, that's the outer edge of the breast. So you want your fingers to be using that whole plate of breast tissue to do the exam. You don't want to just focus on the part that you think of as, sticking out and being your breast. All right, so when you do the exam, you're going to pick your pattern and you're going to use those 3 fingers and you're going to raise this hand up and then do the first pass as gentle pressure, as if you're just imagining trying to get a feel of what's right under the skin. And you're doing this making tiny circles and not lifting your fingers up off of your skin, except to maybe go back. If you're going like this, you can lift up and go back and then go over. So tiny little circles constantly gliding across the skin, just imagining getting underneath that skin to the top surface of the breast. Then you'll go back to the beginning, do the whole exam again with just a little bit more pressure, as if you're trying to feel the middle of your breast. And yes, there's a third time where you push even harder still, trying to feel like against the ribs at the back of your breast. Once you complete that part of the exam, there's 2 final tricks to make sure you've examined everything. The first is to slide those fingers up into the armpit. Make sure you don't feel anything firm and round like a raisin or a little gumball feeling thing. That would be a lymph node. And sometimes your nodes are a little bit big and palpable. You can feel them, but they're always that way. So again, this is the familiarity of, I always have that one little thing that boop, lips by underneath my finger, nothing to worry about. But a new lump there, or 2, or a change, see your doctor. The final touch is to give your nipple a gentle squeeze. You're looking for discharge that is bloody, so red or rusty brown, or clear like water. I don't care about any other color discharge that you can express out. So milky, gray, amber, blue, green, I've seen it all. Any color of the rainbow is fine, except expressing out bloody, rust-colored, or clear like water. If, however, those other colors show up all by themselves in your bra cup or on your nightgown, that spontaneous discharge, that is a reason to check in with your doctor. Okay, now you have another breast, so raise the opposite hand. Use this hand to do your tracing with light, then medium, and then firm pressure. Little armpit check, nipple squeeze, done for the month. So that's not so hard, is it? I'm hoping that this video really helped you understand the basics of a self-breast exam so you can approach your own breasts with confidence and competence month after month. And if you should ever feel a new lump, notice a skin change, a nipple discharge, check in with your doctor. They'll likely get some imaging. You may or may not need a biopsy. Most of the things that we find on ourselves, that doctors find, that mammograms find, 9 times out of 10, are in the category of benign or normal changing anatomy. So rest assured about that. Don't panic. Don't forget to subscribe below and check out pinklotus.com/powerup to join our community. Again, I'm Dr. Christy Funk. Thanks so much for watching this video. And as always, I wish you the breast of health.